Welcome back to the Better Health Now podcast. Today I have the opportunity to sit down with Dr. Tennant, a psychiatrist here at Cullman Regional. Thank you so much for being here.
Yes, thank you for having me.
Yeah, I'm excited to kind of talk through a little bit about the topic of the Zero Suicide Project that Cullman Regional is a part of. But before we dive into that topic, introduce yourself, talk a little bit about kind of your journey to get here to Cullman Regional.
Yeah, sure. So my name is Blake Tennant. I'm a psychiatrist here at Cullman Regional. So I was born in Mobile, been in Alabama my whole life. I did kind of flip-flops between Southern Alabama and Northern Alabama. So I went to medical school at South Alabama. Then after medical school, I came up to Birmingham to do residency in psychiatry. And then I actually did my fellowship in child and adolescent psychiatry. So certified for adults, kids, everywhere in between. And since I've been here in Alabama, I've always wanted to kind of stay here in Alabama or the Southeast, help with, more underserved rural communities. And so, Cullman was a great place for me to, start my psychiatric journey.
Yeah. So is how long have you been here at Cullman Regional?
It's about to be 3 years this summer.
Okay.
So this is my first job post, fellowship residency training. And I started here in 2022, I believe.
Awesome. So diving into this, Zero Suicide Project, Cullman Regional is one of the first and only hospitals in Alabama to kind of participate in this. Can you explain what this project is and why it's important for this hospital to be involved with this?
Sure. Yeah, the Zero Suicide Project, it's a really important project. It's like a systems-based approach to improve suicide care, mental health care, decrease the suicide rates. Kind of the best way to understand it is about 7 core elements that it has. So, the first thing is that we're trying to do is to lead. We're trying to lead change here within the hospital and within the community. We're trying to, lead that cultural change to help everybody feel more comfortable addressing these really sensitive topics, help staff be more comfortable addressing that. The second thing that we're going to do related to staff is we're going to help train staff. We're going to help them to, address these issues better, train them in, talking with patients that are going through, really, really tough times. The third thing that we're going to do is we're going to improve our ability to identify these patients. And the main way we're going to do that is via improved screenings, certain screenings like the PHQ-2, PHQ-9. There are different screening tools that help us assess how risky a patient is and how serious the, possibility of suicide might be. We're going to, put that out for the entire hospital. And then we're going to engage patients with a full safety plan. We're going to work with them on, different protective factors that they have, different, contacts that they have, contacts in the state, and things to do when they're in crisis. And then, the fifth part, which is really important, we're going to treat this. So we're going to treat this in a variety of ways. We're going to treat it, in the ER and at the point of contact with, certain types of therapy, like CBT for suicidal thoughts and CBT for people in crisis. We're also going to get them connected to mental health care, whether it's in our clinic through a therapist or a psychiatrist. And then we're going to also work on better transitioning these patients through the mental health care system. So transitioning them from, say, the clinic if they're in crisis to the ER if they need to be admitted, and then from the ER to either clinic or outpatient resources if they need to be, discharged, or transitioning them to inpatient psychiatric care.
So how long has Cullman Regional been a part of the Zero Suicide Project?
Actually, this is the 1 year mark. So
Okay.
yeah, we are finishing the kind of research and starting parts of the implementation phase. So this is right at a year.
Yeah. So, and you mentioned, you alluded to a little bit earlier, but just the process in which you're going to take a patient through this and like what this looks like for them. I know a lot of this is it's an evidence-based care throughout the hospital, kind of dealing with zero suicide. How do you hope this, or what do you hope this comes from this initiative in the next few years for Cullman Regional and the area as a whole?
Yeah, so several things I hope comes from this. I think the number one goal of the project is to decrease the rates of suicide. So, actually in Alabama, Cullman County has one of the highest rates of suicide in Alabama. So we want to work to get those numbers down. So that's the main overarching goal for sure. Some of the other goals that we have for this project, we want to work to decrease the stigma, surrounding suicide, suicidal thoughts, and just mental health care in general. That stigma can really affect a lot of people. It can prevent people from coming and seeking help. So we want to address that. And then we also want to help, improve the care that we offer here at Cullman Regional and help, staff feel more comfortable providing that care.
So looking at this first 1 year of this project being implemented here at Cullman Regional, a lot of it is research based. And as you've been able to kind of work through this, what has this first year looked like, and how has it maybe changed, or what does it look like for 2025? If like how you better treat patients?
Yeah, that's a good question. I think this first year is really kind of getting all the pieces in place. There's two major areas that we're rolling this out in, and it's going to be first in our clinic at Turning Point Psychiatry. That's the outpatient psychiatric clinic, and then the second area is in the ER. Our overall goal over 5 years is to roll it out within all of the hospital, including all clinics and in the hospital itself. But right now, this first year, we really kind of lined up the pieces for clinic and for the ER. We actually just recently hired a new therapist. We haven't had a therapist here in the past, so we just hired a new therapist about a week or two ago. We're rolling out training to the ER and clinic. So they've got several different modules that they can work on to complete that help them better provide certain screening questions and those questionnaires that I was talking about earlier. So gotten all that uploaded and ready to push out. We've already done that in clinic. We're pushing that out in the ER. And then we've also trained the staff in our clinic, and then we're going to be doing that soon with the ER. So for the next year, it's really going to go live. The soft launch is at the start of January. So both our clinic and ER will be, applying those new methods.
And I would assume as this, the 5 year goal of it to be implemented throughout the whole hospital, though it will also have to increase personnel. I mean, it seems like the team right now is a pretty lean team. Y'all are covering a lot of different grounds. But what does that look like for maybe people that are listening, and kind of like what they can expect, maybe what that 5 year looks like for their experiences throughout the hospital with that personnel increase?
Yeah. Yeah. So that's a good point. So the grant provides funding for at least right now 2 more staff members. So we've already gotten 1 staff member hired. I believe they were either a licensed professional counselor or a licensed social worker. That's one of the top positions. The position under that will be a master's level social worker. So the licensed professional, they'll be doing specific therapy here in clinic and also in the ER. And then the master's level will work with our case managers and social workers, to expand to the hospital. So that'll be like another social worker that can help with case management and, helping to transition those patients to other levels of care.
So for someone that might be listening, what advice would you give to the audience of how they can be prepared or to appropriately respond to someone that they know might be in crisis?
Yeah. So I think the most important thing to do is just to, show empathy, show that you care and that you're interested in what the person's going through. A lot of times people don't want to talk about these really tough subjects that can prevent people from, coming forward and asking for help. So the main thing is just to, show empathy, ask your friend or, if a person's going through crisis, what's happening, what's going on, what they need. And if it does seem like a really dangerous, concerning situation, either encourage them to call for help. And we have several ways to do that. You can either call 911, let them know that they're going through crisis, they're experiencing these suicidal thoughts, you're concerned with their safety. Or you can call the national hotline, 988. That's the National Suicide Hotline. And those have resources in place that can guide you to help that person to get to an emergency room. So that's the main first stop that we need to do, is bring them to the emergency room to get them the help that they need.
And I as the podcast is named Better Health Now, and this initiative that the Cullman Regional has been a part of is definitely moving in that direction. How do you hope that impact of the Zero Suicide Project is able to accomplish and continue to grow this idea of better health now for Cullman County and Cullman Regional as a whole?
Yeah, so I think one of the ways that it can improve that is basically to help people become more comfortable, with patients who are going through these crises. It can also, be very daunting to look at suicide and how to prevent that or how to treat it. And we're here to, tell people that, hey, there are ways, there are, research approved ways that can help at least decrease those suicide rates, you know, lead to the chance of better mental health and prevent some of these suicides from happening. So we want to show them that there are certain things that we can do that are research backed that can decrease the risk of suicide. This program, it's been pushed out in multiple states and at a federal level. It's shown a really good decrease in suicide rates across several different places, and so that's what we're hoping to bring here to Cullman Regional and hopefully to Alabama as well.
Yeah, well, I appreciate you taking the last little bit, talking a little bit about Zero Suicide Project here at Cullman Regional. I think the impact it's had in the first year has probably been amazing, and I continue to look forward to the impact it'll have in 2, 3, 4, and 5 years down the road. And we'll be sure to put anything in the show notes for any information that we've talked about for people to find out, see the hotline, see ways in which they can have their loved ones find help. So thank you so much for being here.
Yeah, thank you for having me.